friends, it's Carla, your online doctor, with today's Live in 5. Today is Thursday, October 8th. It is 5 p.m. It's been a crazy couple of days, but we are on day 4 of a series from a Facebook post that a dear friend of mine shared with me, a medical colleague, all about the potential COVID-19 vaccine and how to best see what's going on from a medical standpoint in layman's terms. So if you missed any of the talks that I've done over the past couple of days, please go back and watch them. Share them with people that you care about. I'm pretty passionate about the information I'm sharing. I've been sharing this for weeks or months, but it was nice to see my thoughts validated by somebody that I respect. So a medical person that I respect. So Monday we talked about vaccine interference and immune priming. Very important for you to understand what that's all about. Tuesday we talked about genetically modified viruses incorporating into your DNA as a means of this new vaccine technology never used on humans before, which we are the guinea pigs for pharmaceutical companies. I mean, not we, whoever's taking them, because I certainly won't. And yesterday we talked about a little bit about herd immunity of sorts and how best, if you're going to get COVID-19, and I'm not telling anybody to go out and seek it out or try to get it, but how to get an asymptomatic or mildly symptomatic case of it should you be exposed. And we're going to continue that today. And one of the things we talked about yesterday was wearing a mask. And again, I know it's a highly debated topic. I'm happy to say I did not see any negative comments on my page, and I appreciate that. Again, if you don't agree, scroll past, don't watch the rest of the video. It's all good. Everybody's entitled to their opinion. I like to base mine on science, and that's why I share it with you guys. So the next part of how to get a mild case of sorts is another thing that I talk about often, which is vitamin D. Vitamin D is so important right now, and I wish I had my test results to share with you because I just got tested again on Tuesday. My last vitamin D level was 73. I'm trying to get it a little bit higher into the 80s. Hopefully I'm achieving that with my supplementation. But most, we'll talk about that in a second. So I can't stress enough vitamin D, vitamin D, vitamin D. Okay, there are numerous studies showing direct relationships between vitamin D deficiency and COVID-19 severity. So the lower your vitamin D levels, the more severe a case of COVID-19 you will potentially get. In Indonesia, a D level of 20 or less was associated with a 99% mortality from COVID-19, less than 20. Remember, I told you mine was 73. So levels, the two countries with the lowest mean vitamin D levels in Europe are Italy and Spain, with levels averaging 26 and 28 respectively. A recent study showed 97% of all mild COVID cases were in patients with D levels above 30, and 98% of all severe cases had levels below 30. 30 is still too low, in my opinion. But again, we're talking about a relative number right now, so you have time to start supplementing. This all makes sense since vitamin D is critical to the optimal function of your immune system. Additionally, both the cytokine storm and the bradykinin storm, the two killers of this infection, are vitamin D controlled. So deficiency not only allows for these immunological explosions, but vitamin D is actually consumed in the storm process. So people with marginal or low normal levels can quickly become deficient, which puts them at further risk, which is why you don't want a level of 31 or 32. You want a level of 50, 60, 70. You want those numbers high enough so that in the event your body has to create an immune response and vitamin D is being consumed, you have plenty and you keep adding in on a daily basis. In addition, obese people, okay, listen to this, need about 30 to 40% more vitamin D than non-obese people because vitamin D is fat soluble and it gets sequestered in body fat and it is unavailable in the blood for use by the body. Okay, so, right, obese people are having a harder time with COVID-19. This could be one of the reasons why. In addition, African Americans tend to have lower vitamin D levels because the UV filtration by the dark skin, their median D levels are around 16. Yes, that's under 30. So it puts them at higher risk. Again, African Americans are having a very hard time with this disease. Okay, so here is a great reason to up your vitamin D levels. Now, this does not take away from the higher incidence of comorbidities, lack of adequate health care, etc. I understand all of that, but take into account just the science, and this should be an aha moment for many people. Now, both vitamin D deficiency, vitamin D deficiency is a major player in the disproportionate death rates amongst African Americans and the obese. Okay, it is definitely by far something that can be addressed. Now, the wellness medical community has long recommended optimal D levels, and many suggest as high as 60 to 80, like I'm telling you. Unfortunately, most labs consider 30 to be the low end of normal. My recommendation, again, is about 5,000 international units per day of vitamin D3 until your level is in a good range. Now, please, I am not your doctor. I am just making medical suggestions based on my personal experience, all the things that I've read. So discuss this with your healthcare provider and have them guide you on what you should do. But a daily recommended allowance of 1,000 international units is just not going to cut it. So you need to kind of up your levels until you're in a good range, and then you may be able to taper off. Understand, we're also heading into winter time where people who are in non-Florida areas or warm temperatures, you're not going to be outside, you're not going to be getting the sun exposure to convert that vitamin D naturally. So either food or supplementation is going to be your only way of getting vitamin D in the coming months. So this can become a contributing factor in the coming months if people don't up their vitamin D levels as to the severity of the infection that you might get. So I can't stress it enough. Again, I take an amazing vitamin D supplement, which I love, and anybody who, like maybe the next 2 or 3 people that don't take the same supplement as I do, if you message me privately, I will send you a sample, and I will send you information on how to get it wholesale and all that stuff. So throw it in the comments or message me privately. I'll be happy to share. It is by far the best vitamin D supplement I've ever taken. And again, it is a vegan option, which not all vitamin D, most vitamin D on the market is either synthetically made or derived from animal-based ingredients. So there's that as well. So on that note, get out in the sun, take some vitamin D, vitamin D3, and decrease your chance of getting a bad COVID-19 infection. Hopefully you guys are having a great day, and I will see you again tomorrow for another Live in 5.